Diseases affecting the coronary artery are considered very serious and, if not properly handled, can prove fatal. An example of such diseases is angina.
Welcome to Simplified Health Tips. I'm Andrew. Today Michael and I will be talking about angina. We'll cover the causes of angina, the treatments and ways to prevent it. So drop a like on the video, hit that subscribe button and let's go. First up, Michael, what is angina?
Angina is characterized by insufficient flow of blood to the heart. This insufficiency leads to severe pain, especially in the chest region. Angina is often referred to as angina pectoris. It is popularly described as a tightness around the chest region or a feeling of intense pressure and heaviness. Expert healthcare providers advise that you seek immediate consultation when you notice heaviness in your chest area. Even though it might not be angina, not every chest pain is, it is still important you have it checked out.
Okay. So, what are the symptoms of angina?
There are several signs and symptoms of angina that could help with diagnosis. Apart from pain in the chest region, uneasy feeling in your chest that can be described as a hot heavy weight on your chest, pain in some other parts of your body including your arms, spinal area, neck or jaws. Angina has several other general symptoms that will help with diagnosis. They include lightheadedness/dizziness, exhaustion, nauseating feeling, inability to breathe properly and perspiration. Angina occurs in three different ways: stable, unstable and variant. It is pertinent to note that only a certified medical practitioner can say with certainty which type of angina it is you're having.
Interesting. Michael, tell us about stable angina.
In stable angina, the pain comes when you perform any activity that puts a strain on your chest or exposes you to extreme temperature change. Stable angina has certain characteristics that differentiate it from unstable or variant angina. In stable angina, the pain you experience is strikingly similar to that of other feelings of pain in your chest that you may have experienced in the past. The pain has a very short lifespan. Stable angina is usually caused by extreme stress or difficult physical activity. Certain measures like sleep or painkillers could relieve the pain caused by stable angina.
So, how is unstable angina different?
The unstable angina is a more severe condition, and it shares similarities with the experience of having a heart attack. The unstable angina has peculiar characteristics that help in its diagnosis. The unstable angina can occur at any time, it has no specific precedence. This type of angina has a longer lifespan than the stable angina and may last up to 30 minutes. Unstable angina can happen at any time, even while you are perfectly still or sleeping. Painkillers prove ineffective in relieving the pain caused by unstable angina. This type of angina might precede a heart attack.
Interesting stuff. Now, please tell us about variant angina.
This type of angina is the least common. It is caused by sudden seizure of blood in the arteries that makes blood flow to the heart insufficient.
What are the causes of angina?
Angina generally is caused by the sudden seizure of blood in the arteries. Oxygenated blood is blood that transports oxygen to the heart muscles for oxygenation. Your heart muscles require this oxygenation to prevent ischemia, a condition characterized by reduction in the flow of blood in the body due to an obstruction of the blood vessels. Disease of the coronary artery is the leading causes of ischemia. One of those diseases is called atherosclerosis. This is the thinning of the arteries by small deposits of fat. When your heart muscles aren't getting enough oxygen to carry out their function of contraction and dilation, your body makes up for this deficiency and enables the heart to manage without enough oxygen. However, when there is a greater demand for oxygen by the heart muscles and there isn't any to satisfy this demand, it might give rise to angina.
What are the most common causes of stable angina?
The primary trigger for most cases of angina is physical stress on the body. However, there are secondary triggers like emotional disturbance, low temperatures, heavy eating and unhealthy habits like smoking, excessive use of alcohol, and lots more. When there is already an insufficiency of blood in the heart and then physical and emotional stress is added, it will lead to stable angina.
Are the root causes of unstable angina any different?
Blockage of blood flow in the artery can be caused by the gathering of small deposits of fat, which is referred to as atherosclerosis. This blockage prevents the heart muscles from getting sufficient oxygen. This is why measures like sleep or painkillers do not seem to have an effect. This condition starves the heart muscles of oxygen, and if there isn't anything done to improve the situation, it could lead to a severe heart attack.
How about variant angina?
When there is a sudden seizure of blood flow in the artery, the heart muscles are deprived of oxygen, and this could become fatal if measures aren't taken to improve the situation. The variant angina doesn't seem to reduce during sleep. In fact, it commonly occurs during rest. Certain other triggers like emotional stress, smoking, alcohol, and use of illegal drugs could speed up the process of variant angina.
Michael, are there any known risk factors for this condition?
There are certain factors that increase the possibility of the presence of angina and diseases of the coronary artery. These factors include diabetes. Diabetes is a prevalent factor of diseases of the coronary artery, thereby leading to angina and heart attacks. During diabetes, there is an elevated cholesterol level in the blood, resulting in atherosclerosis. Tobacco. Prolonged use of tobacco in various forms could damage the walls of your arteries. This could lead to the artery not fully fortified enough to prevent accumulation of fat. Elevated blood pressure. Increased pressure of the blood over time has fatal effects on the arteries. The elevated blood pressure could result in hardening of the arteries. This is called atherosclerosis. Elevated cholesterol in the blood. Increased amounts of cholesterol in the blood leads to harmful accumulation in the arteries. Accumulation of bad cholesterol, known as low-density lipoprotein, increases the risk of angina. Aging. The older you get, the higher the risk of angina. It is more prevalent in older people. Family medical history of heart diseases. Insufficient physical activity. Obesity and stress.
Are there any complications our viewers should be aware of?
Certain severe complications can arise from angina, which would make doing basic day-to-day activities uncomfortable and difficult. The most severe complication that may arise is having a heart attack. Fortunately, there are several signs and symptoms that indicate you are having a heart attack. When you experience them, call for help immediately. They include tightness in the center of your chest area that lasts for some minutes. Enveloping pain spreading to your limbs, back, and even teeth. Frequent occurrences of chest pain. Nauseating feeling. Pain in the upper part of the abdomen. Perspiration. Blackouts.
Wow. Sounds very serious. Can angina be prevented?
These healthy lifestyle choices could reduce the risk of you having angina. Avoid smoking. Maintain quality general health. Include healthy foods to your diet and eliminate unhealthy foods. Increase the number of physical activities you do daily. This includes going to the gym and taking long walks. Decrease the amount of stress you undergo. Reduce your alcohol consumption. Ensure you take flu shots yearly to prevent the flu. This is because the flu could cause heart complications.
Okay. Those are some great tips for optimum health too. But, how is angina diagnosed?
When you notice the symptoms earlier listed and you consult your doctor for his final diagnosis, he will request some tests. Electrocardiogram, ECG. Stress level test. Echocardiogram. Chest X-ray. Blood tests. Coronary angiography. Cardiac computerized tomography, CCT. Cardiac MRI. These tests will help the doctor with his diagnosis and subsequently treatment.
What treatment options are there for angina?
There are several medications for angina. These medications help improve the symptoms associated with the condition. However, severe complications from unstable angina should be handled in the hospital immediately. Nitrates, they are used to improve elasticity of the arteries by contraction and dilation. Aspirin, aspirin is known to reduce the speed of blood clotting, thereby allowing free flow of blood. Beta blockers, reduce the efficiency of epinephrine hormone, thereby reducing blood pressure. Statins, these are drugs that are known to reduce the level of cholesterol in the blood. Calcium channel blockers, these also act to relax and contract arteries. Blood pressure lowering medications, as the name implies, these drugs act to lower blood pressure in the body and are suitable for diabetics and people with symptoms of heart failure. Ranolazine, these drugs can be used with beta blockers or calcium channel blockers.
Wow! That's a lot of drugs. Are there any recommended lifestyle changes and home remedies?
To reduce the possibility of angina, you must first reduce the possibility of any heart disease. Significant changes in your day-to-day life can prevent you from the dangers of angina. Quit smoking and avoid inhaling smoke fumes. In the case of obesity, consider a strict weight loss regimen. Ensure you include healthy foods in your diet. Ensure you take regular rests between working hours. Include a healthy exercise plan into your lifestyle. Treat underlying disease conditions that adversely affect your heart. Avoid overeating. Avoid unnecessary alcohol consumption.
What about alternative medicine?
There are several options that could be used in treating angina. Some of them include stimulation of the spinal cord, revascularization of the myocardium using laser technology, angiogenic therapy, enhanced external counterpulsation, other neuromodulatory treatments, anesthesia of the epidural space, treatment for chelation, heart transplant.
Thank you, Michael, for that wealth of knowledge. It's always a pleasure having you. I've learnt a lot about angina today. To our viewers, I do hope this video has been helpful to you. Remember, always speak to a doctor about your health status and conditions. If you have topics you want us to cover, please leave your suggestions in the comment section. Until next time, I'm Andrew.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.